Hello, today I'm going to discuss with you sort of a anatomical VIVA, how you would do if you get a sacrum as your specimen. So, first of all, when you have the bone in front of you, you should identify this bone as the sacrum. Then you should name this bone as the sacrum. Then you should give a sort of brief introduction to that. The sacrum is a large, flattened, triangular bone formed by the fusion of 5 sacral vertebrae. It forms the posterior superior part of the bony pelvis. And you should tell about the articulation. It articulates on either side with the corresponding hip bones at the sacroiliac joint. The upper part of the sacrum is massive because it supports the body weight, and also it articulates with the final lumbar vertebra. And the inferior part, it directly articulates with the small bone which is called the coccyx. That's enough for the introduction of this particular bone. Then you should tell what type of a bone is this. You have to tell this bone is a flat bone from its origin. Okay, then you should tell the anatomical location of this bone. You should tell that this bone forms the posterior superior aspect of the bony pelvis, and the two bones which are called the pelvic bones or hip bones are articulating from these lateral sides of this bone. Okay, then you can explain briefly the major parts. You have to say this is a triangular flat bone which has a base, apex, and you have this surface which is called the pelvis surface or pelvic surface, and the dorsal surface which is irregular and has some processes and tubercles, and two lateral surface for the articulation of the hip bones, and the apex where you can find out the articulation of the coccyx bone. Okay, then you should go to the minor anatomical features of this particular bone. I'm starting with this point. This is called the auricular surface of the bone. This one is the auricular surface of the bone. Then we have pelvic surface. This is the pelvic surface of the bone. Then we have this special ridge-like thing which is called the promontory. Then if I come to these two particular figures, in these two figures they have showed you very accurately that body of first sacral vertebra. This is the body of the first sacral vertebra. Then as in other vertebra, they also contain with this lamina. These are the two lamina you can see from the either sides. Then you have lateral parts which are called the ala, sorts of a butterfly. It shows like a butterfly from the above. They are ala, which forms the lateral masses. Then we have the promontory. Once again you can see from here, this is the margin of the promontory. Then we have sacral canal. This is the sacral canal where the terminal part of the spinal cord travels through. Then we have spinous tubercle of the median sacral crest. This is the spinal tubercle of the medial sacral crest. Then superior articular process. As in other vertebra, it also contains with the superior articular facet. This one is a superior articular process. Then I move it into the other diagram which is given in the Macmillan book. There are some special bony features. Once again they have mentioned over here. These are called the coccygeal conua. These two particular features are called coccygeal conua. Then we have facet for coccyx. This is the facet for coccyx. Then we have first coccygeal vertebra. This is the first coccygeal vertebra.